Hi, everyone. It is another episode of Life Possible with a Disability with Karen Roy, and I'm her host, Karen, and this is my dear friend, Heather Markham. She is also my coworker, and I guess coworker came first and friend came second, but it was a close second because we started.
Boom, boom, wasn't it?
Yeah,
It was like nearly instantaneous.
Yeah, because we started our first kind of real interaction was with what we called the Employee Consumer Council, which is a council that we put together within New Motion, which is all people that use wheelchairs for mobility. And so we started working with Heather like that, and then we just became fast friends. Sometimes we have a Teams call just for our mental health, right, right? So, she is one of our virtual ATPs, and she lives in Arizona in the desert. And I will let you, she has a very, very, interesting history. She also, her disability was not due to an injury. It's due to a disease process. And I'll let her explain a little bit of that. And our topic for today is going to be accessibility in the medical care arena. So, there's a lot of barriers still in 2021 to people with mobility impairments and probably other disabilities as well. But Heather and I are going to mostly be speaking about people with mobility impairment and our ability to access medical care on many levels. So Heather, why don't you give us a little introduction of yourself and we'll get going with today's topic.
Sure. So I'm actually the virtual ATP.
Oh, you're the? Oh, cool.
I'm the.
Okay. Yeah. I didn't realize that.
Yeah, I'm the only one.
That's cool.
So I'm going to start this by saying that there are my face is very expressive. It turns out because I used to talk with my hands.
Yeah.
But I have a limb-girdle muscular dystrophy, which means that my shoulders and my hips, they're very, very, very weak. And so I'm going to awkwardly show your people what it's like to touch my nose. And we're going to lean and go like that. Okay,
yeah.
So there's all kinds of crazy stuff. So, so my face gets like kind of.
I feel like mine is very expressive and I can still use my hands. But I think neither one of us were probably ever born with a poker face. But yours is probably definitely gotten more expressive.
It's gotten definitely more expressive. So I came to New Motion after 8 years with Kentucky Vocational Rehabilitation as an assistive technology specialist. And my focus was people going to school. I worked in the Louisville area, and so was able to help. And I learned a lot about invisible disabilities there, but I was also the state's wheelchair expert and actually helped write the manual.
Wow.
For wheelchairs. Before that, I was hanging out in Pittsburgh, earned a master's in rehabilitation science and technology. And I had actually left Edwards Air Force Base, where I'd been working as an electronic warfare engineer, to go back to grad school. And my dad said, "Why would you go where there's snow?" And I said, "Follow the money. You always follow the money." And Pitt has all of the money in this arena. And prior to electronic warfare, I ran my own web design business out of my house. And before that, I taught college. And before that, I got a master's in computer science and technology. Was a secretary for a bunch of years and actually have a bachelor's in elementary ed from Texas A&M University.
And there's one more thing that you didn't mention.
There's several. Let's see. So,
but my favorite.
The fact that I used to belly dance.
No. Oh my God, no. That could be my favorite. But you have some kind of degree from Disney.
Oh, so I have Disney University. Yeah, it's over my shoulder. So I have a doctorate in studio production, which means that I was at Disney World on the college program, and I went to all 10 of my classes that you were required to attend. And I did the project, the capstone project, and so now I have a doctorate.
Yeah. Adorable. This is why I was not going to try to do Heather's history, because she's super smart and she has more degrees than I can remember. So
and so I was a belly dancer and Miss Wheelchair Kentucky.
Yeah, right. We are Miss Wheelchair America's
surfer.
sisters, right? Because that's a sisterhood. Yep.
Someone said to me, "Oh, it's just too bad you have a wheelchair." I'm like, "Earned a tiara for running my mouth over the age of 40. Like, are you kidding?" And I'm a competitive adaptive surfer. Like, these things would not have happened
Right.
without the wheelchair.
Yep. She is a competitive adaptive surfer. Also super cool. Yeah. So, and she recently wrote a book.
I did.
And we're still waiting for our copies to be released patiently. But yeah, she's an author as well.
And international award-winning photographer.
Oh yeah, I forgot. That's it's a lot, Heather. It's really a lot. It is.
It's a lot.
Clearly, yeah. My very, very high achieving friend. So, all right. So with this topic, you actually brought it up to me. I think you sent me an article. And then I thought, why have for the entire time I've been paralyzed, which is 33 years, I kind of got used to, and I've really admitted in my early days of my disability, I had very ableist way of thinking. I was trying not to be an imposition to anyone. I'm trying to be the easiest paralyzed person you ever dealt with. Very, very few, public complaints. I mean, occasionally, but it had to be pretty significant. But I've been being picked up by my physicians, like my OBGYN had to pick me up for all of my OBGYN exams for my 3 children. I killed myself not gaining a ton of weight. I mean, for multiple reasons, but one of them was I had to be picked up by my physician to be put on the exam table to check, so even for my yearly pap smears, that's how it's been. So as my doctor got older, I would bring either a male friend or I believe I even had to bring one of my kids once. Austin, my kids are 27, 23, and 21, and Austin's producing the show. And I want to say that he came with me to an appointment and had to pick me up and put me on a table. We can't be weighed in doctor's offices. They're typically not scales that can accommodate a wheelchair where we could subtract the weight of our chair from that total weight, or even a table that you could lie on and then calculate the weight. So, why don't you give us a little bit of the history? Because we do have some vague protections through the Americans with Disabilities Act. There are some other sort of rules that have been written but Heather's very well versed in this arena. So why don't you take it away for her?
The ADA, right, that was passed in 1990. There have been a bunch of incremental updates along the way. And the U.S. Access Board is an independent body in Washington, D.C. that's made up of elected members, and they have terms and they're elected by the current administration. And then there are civil servants who have applied for jobs and have jobs on the council that are not on the board, that are not political appointees. And there are civilian members, and they are nominated and then voted in. And so most recently, and when I was in Pittsburgh, Washington, D.C. is close. It's 5 hours.
Mm-hmm.
And so I used to go down to the Access Board meetings because why not?
Because you're Heather Markham. That's why.
I really wanted to work for the Access Board is what I really wanted to do. And
yeah.
I'm trying to get my face known so that would work out, but other things worked out instead. But so they finally in 2017 wrote what the rules are. It's kind of a funny thing. But the standards, they don't write the rules. They write the standards for medical diagnostic equipment in 2017.
Right.
That's a really long time.
Too little, too late.
Well, yes and no. I mean, too little, too late for us.
Right.
But for the group that's coming up behind us. And part of what I feel that my responsibility is, and part of what you're doing with your podcast, is we're paving the way.
Yeah.
Right.
Well, we have
It
to
may not
like,
be great and smooth for me, but if I
yeah,
can reach back and show you that this path isn't as frightening as it looks like,
yes.
and maybe I've helped kick down some of those walls or run into them hard enough with my power chair that they fell over.
Yeah. And I mean, it's, I'm kind of ashamed of myself that, like I didn't use my voice earlier. Like because finally, when you brought this issue up to me, I went to my doctor. I had an appointment up for something. And I said, Dr. Carlisle, that Baton Rouge Clinic is one of the largest clinics, or probably the largest clinic in Baton Rouge. And I was like, none of these tables are accessible for anybody with a mobility impairment. I was like, and we can't weigh ourselves when we come here. And which is key to like so many things: congestive heart failure, diabetes, like, medication. Yeah.
What's your medication dose?
Yeah. Yeah. So, and we literally have no idea. So, and the whole time I was pregnant, as a wheelchair user that takes her chair apart and puts it back together again, I had to go in South Louisiana, typically in the 100-degree range, get my pregnant self out of the car, get my chair out of the car, go into a rehab hospital, get on a scale, weigh myself, get myself back in the car, drive to the other doctor's office, to the OBGYN's office, be picked up, which isn't really the safest thing anyway for me or the doctor or anyone doing it. Get me up on the table and then give them my weight. And then, and I just kind of took that in stride and never complained. And therefore, guess what? Not just me personally, but it's not fixed. And so so hopefully this podcast and then us kind of like making it an issue, and you get Karen and Heather involved in something, we can make some things happen. So,
at least we make a lot of noise.
We make a lot of noise. Yeah. Yeah. Let's see what happens. But, I guess
I've had the scale issue too. Like
the
weighing thing.
Yeah.
So there are not awesome ways, but there are, so instead of being picked up, like someone could, if the scale, and you're tiny, right? You're like a size 4.
Yeah.
Yeah.
I try.
So someone could literally pick you up and stand on a regular scale.
Yeah.
And then subtract out their weight, right?
Mm-hmm.
But
yeah. Yeah.
And I'm not a size 4.
Right.
And I had a doctor who called around to see if there was a place, and he said, "Oh, well, you could go over to the loading dock." Karen, the loading dock.
Yeah.
I was mortified.
Yeah. Yeah. Have you ever been told to because that's what that reminds me of, is like when we've always have to go in the service entrance to there'll be like a really nice restaurant and there'll be this beautiful grand front staircase, and they'll be like, oh, she needs to go in the service entrance, which basically is the loading dock.
Yeah. I've been sent through kitchens.
Oh yeah. Me too.
And stuff. And you have to push through that.
Yeah.
Which then means that your hands get gross because restaurant kitchen floors,
disgusting.
Not super clean. Yeah. Disgusting was a much better word for it. Yeah. But.
Yeah, you're right. So, and none of those, that's not acceptable.
Not acceptable.
Right.
Not acceptable.
So tell me a little more. The Access Board wrote these standards, and I'm happy about it, but it's basically their guidelines or recommendations for medical facilities, and they're not requirements, and they're not enforceable. Is that true?
As far as I understand it,
right.
The Department of Justice is responsible for enforcement. I've always felt that it was kind of low on their list.
Yeah, I think so.
So I don't really know what's going on with medical standards. I think it's up to us to ask.
Mm-hmm.
But there are lots of places. At my women's health doctor, they didn't pick me up. There were no people who were going to pick me up. I had nurses holding my legs.
Yeah. Yeah.
And at my last dermatology appointment, I can't get on their chair. So I just have to show them the places so they never look at the back of my legs.
Right. Yeah.
And they're like, well, did your caregiver see anything? Okay,
Right.
well, maybe when she was hoisting me out of the shower, but she doesn't know what she's looking at.
Right.
She's
Exactly.
not a dermatologist.
Right. Yeah. And so it really does then fall on us to like make sure that we have someone take a picture, that we like, bring it to the doctor. We don't have equal access to medical care is the bottom line. And as a result of that, we have higher rates of obesity and higher rates of, you name an illness, and we're sicker than, and there's a multitude of contributing factors to that. But our lack of ability to be properly diagnosed, because we simply don't have the proper exam table, we don't have a scale. Even when they're doing x-rays on me, depending on the positioning of the x-ray, sometimes they'll put the x-ray thing like behind my back, while I'm sitting in the chair, and, take my x-rays like that. Mammograms were sort of a big issue. I've always done mine in a seated position. And I guess, that seems to have been okay. But for a lot of people, depending on their, like you said, like my wheelchair is really small. It's a manual chair. I have the use of my upper body. For many other people who are wheelchair users with upper body impairment who use a power chair, you can't just be picked up or scooched around or, adjust yourself or scoot yourself up in the chair, so, although it's not been a cakewalk for me, it is impossible for other people.
It is. And so my disease has progressed from, I seemed perfectly healthy until injuring my back at the age of 22, which I believe, and there's now medical backing for the fact that it triggered, that event triggered a genetic disorder in me.
Wow.
And at 34, I got diagnosed. So I got these 12 years where I starting to get difficult to get out of chairs, and I'm starting to walk badly and slowly, and I got a cane, and then I got a rollator, which is one of those old lady thingies, right? And then I couldn't even get up from that. So I started putting cushions on it, making it taller and taller and taller. Well, trying to stand for a mammogram in those days was like a nightmare because I wasn't stable on my own 2 feet. To stand still. Now my chair elevates, so that makes some things a little easier. And I can, if there's enough planning and preparation and I know about things, I can elevate my wheelchair if I've brought my slide board and my transfer board, and someone can slide me across to various things if that's possible, but that's not always possible.
Right. How do you weigh yourself these days?
I actually go to the New Motion branch office.
I really can't get on the scale.
Yeah, it's the easiest place that I have.
I don't think my branch doesn't have a scale.
Okay, well, that's certainly something that all New Motion branches should have.
I'll have to check. I hate to be to tell a lie. But yeah.
Do you want to call out the company?
Yeah, no, I don't actually. But our office did recently flood too in Baton Rouge. So, but I mean, I guess it could be something that was in the warehouse. I don't really know. But so, because the last time I had a obstructing kidney stone and I ended up in the hospital, they put one of those like Hoyer type things underneath me, slings, and weighed me like that. I did figure out a way. Now, this is only for, like you said, I bought a big dog scale, off Amazon. I know. And then I get out of my manual chair on the floor and get on the dog scale, sitting on it, holding my legs up. And so again, but I'm not the best at like getting back from the floor back to my chair without assistance. So I still need help. I did a couple of times do what you said and have a person stand, weigh that person, then the person stand with me, holding me. But have you ever tried to like hold a human and like look down at your feet and like look down at neither one of us could really see? Dangerous. Okay. Not recommending it. The point being, so that when I did bring all this up to my primary care doctor, she said, I'm going to bring it up to the board because at least, so I think 3 doctors usually share a pod. per pod, there should be at least one exam table that electronically lowers. Because for people who have a power chair, this is another reason to have seat elevation, for power wheelchairs as a covered item. CMS, if you're listening, should be a covered item. And standing features also for power chairs. But so for someone in a power chair with a seat elevator, maybe with a caregiver, maybe you could get them to the exam table, but maybe not.
That's not a guarantee at all.
And exam tables are small. And there's not a lot of side on. So even once I'm up there, I feel afraid, because there's really nothing on either side of, kind of holding you up there. And when you have poor balance, I feel like that's an issue as well.
Well, and if they could get me onto the table chair that's in the dermatologist's office and they want to roll me, like to look at, a side or my backside.
Oh yeah.
If once you roll me onto my side, unless I do a whole lot of weight shifting, I actually get scared. And I'm like, I'm scared.
Yeah.
Because I fell out of bed and broke my hip.
Ugh.
And so that whole being on my side thing kind of freaks me out.
Yeah.
If I don't have control. Right. So there's huge danger involved, and osteopenia, right? Probably
yes.
osteopenia.
All of us.
For you, right? Because brittle bones, well, not you because you stand all the time. But
no, I mean, I still, I fight it, but it's, I do my best, but that doesn't mean my bones are still way more fragile than an average standing person. And I don't think people that don't have a mobility impairment understand our lack of balance and that, I haven't had a fall yet that resulted in a fracture, but I still have that same fear. I'm petrified because the reality of it is that we could very easily get hurt, and that I'm not sure other people understand how poor our balance is and how dangerous that really could be. So
every time you get transferred, you run the risk of getting injured.
Yeah. Yep.
Even just not being moved, just being picked up and moved around.
Yeah.
I've gotten injured lots of, by very well-meaning people.
Yes.
Who thought that things were okay, but my neck got jammed up or I got dropped on something or, So I was surprised that when you were in the hospital, they didn't weigh you in the bed.
Yeah, so the bed didn't have a scale, I guess, and the actual built into the bed. So they had to bring this sling thing in that was basically like a Hoyer, about like a piece of meat or fish. Yeah, exactly. Yeah.
I just asked all the hospitals that I've been in Louisville. I was in hospitals a lot in Louisville. They all had bed scales
in them. Yeah. Some of when I worked in medical facilities, some did, some didn't, but I don't know. This one didn't. We kind of, if somebody wants to find the recommendations that were written by the Access Board, we can add a link to the show notes. So I'll make sure that we do that if somebody wants to read them in detail. But what do you think the steps are that we should take as a disability community to bring awareness to this too? Because I feel like, we've now explained the problem. And for me, it was kind of eye-opening at 33 years to really look at this and go, wait, whoa, why are we in the stone ages when it comes to this stuff? And so what can we do to move this issue forward?
Well, I think it happens at a grassroots level, right? You're getting things changed by just talking to your doctor.
Right. Yeah.
And if that doesn't work, you have enough connections, but your listenership also has enough connections to start bouncing their way up the food chain.
Yeah. Yeah.
Right. And going to the hospital board or going to the hospital group board or whatever.
Mm-hmm.
We shouldn't have to use a loading dock scale.
Right. Yeah.
I mean, we shouldn't have to be creative about how we're going to make our positions easier for the physicians,
right.
To access us, which is, sorry, that was
right.
really graphic. But gosh, I really wish you could cut this, but I'm sorry that you can't. Um, like we've been really super accommodating, right?
Yes.
You
Yes.
and me both.
Yes.
One of my friends was like, I'd have just made a fuss. I'm like, I didn't have the time.
Right.
Right?
And
But how long did it take you? 5 minutes? 10 minutes?
yeah.
It's an easy conversation.
Yeah. No, it was
Yeah.
amazing because she basically said, yeah, I could just basically, we're not, first of all, we all know that they're making oodles of money. Let's be clear. But let's just say that we don't want to make this cost prohibitive for them. We're asking for one accessible table per pod and one scale maybe per floor of this building. So we're not saying every single doctor has to have one in every single room, but there should be that option, and it doesn't even exist as it is now. And she was like, that's a completely reasonable request. Now, what happens, I will let you all know later on. I will, do some follow up. But anyway, so yeah, it's the other thing I was thinking, huh?
I think it's up to us.
Yeah, no, it is. And then I think that, maybe we, the way that I've seen this process work before is when you can't really get, a conglomerate of us is obviously going to be a louder voice than us individually. And granted, it may be a very simple solution in your community. You speak to your local doctor and you get it fixed, and that's a win. But, this might be something that we bring up to some larger groups like United Spinal Association, because we have these state chapters, right? We could bring it up as a state issue. So a state could take it on as an issue. Like I could speak with our Louisiana chapter of United Spinal Association. We bring it up on a state level. The way I've seen this work before, like with seat elevation and standing, I was part of a group of people that went to lobby in Wisconsin for the Stand with Dignity bill. And we got that passed. It got included in CRT that standing features in power chairs should be a covered feature. So when you get a win like that in a state, and then you can take it to a federal senator or a representative and say, can we create some legislation like this state legislation and make it federal legislation? Because I do feel like that this deserves more attention than just some standards, just some standards that can voluntarily be enforced. Because as we know, even things with the ADA that are law and should be those don't always happen either.
No, they don't. And I think, so I really support your getting groups involved. Like the Muscular Dystrophy Association should be all over this.
Yeah, that's true.
The MTA clinic in Louisville did not have access to a wheelchair scale, which, that level was really low. So it seems to me that all of the big MDA clinics should have wheelchair scales, right?
Right.
I mean, they have regular clinics, and as muscular dystrophies progress, you get great big complex rehab chairs,
right?
That vary in weight depending on whatever you've put on them. Everything adds ounces and pounds, and thigh supports and headrests and backrests and robotic arms and you name it, and it adds weight.
Yes.
Right?
Yeah, that's a good point. And like I'm sure ALS clinics too come to mind. But I mean, there's really there are a lot of elderly people who aren't even using a wheelchair for mobility, who have probably difficulty getting up on those tables. And as the American population continues to age as it is, this should be a thing. It should be a thing in like every doctor's office. So,
I agree. I was very surprised that the colorectal surgeon in this area, and I'm south of Phoenix in the retirement area.
Yes.
Really surprised that he did not have a table that I could access.
Yeah.
Because his population is certainly elderly.
Yeah, definitely.
Yeah.
Well, so I guess moving forward, and I know you have like some contacts on the Access Board, and we're gonna continue to follow up with this as an issue and bring it forward. So maybe we'll do like a follow up episode at some point. As Heather and I move forward and get some more information, and then maybe we bring this up, as an issue on a state level. So, Heather, Heather and I work on a lot of things together. The Disability Alliance Network is our New Motion's employee resource group, and we work on a lot of issues together in that arena. We still have our groups that are specifically the wheelchair users within New Motion, and we create things called pro tips. So, and also you can find those pro tips. Go to newmotion.com and you can actually search pro tips, and you'll see that some from Heather and a bunch of our other wheelchair users that are all employees. And then I will have her as a guest again as soon as we get access to her book, and we can talk all about that. So I'm really excited. But Heather, I just adore you. I am so thankful to have you as one of my first guests on the Life Possible podcast, and I will see you again soon.
Hey, Karen, thanks so much for this. I really appreciate it. I feel really honored, and always appreciate the opportunity to express my opinion, run my mouth, and see you. Like, but not necessarily in that order.
That's all right. I agree. All right. Well, we will see you again soon.
Okay, thanks.
Bye.
Bye.
Okay. That's a fake hang up. So we're going to hang. Now I'm going to disconnect, but you can't hang up really because we have to.